All right, folks, so starting off on the cervical spine, we go ahead and use a small dual probe, and we also go ahead and make sure that the force setting is down between 0 to 50% of its lower end range. So we're going to do this, we're going to turn all the way to the right, and that's 0. Backing it off a bit, we can go 0 to 25% of the range, and about halfway is 25 psi. So although this is not going to give you the exact reading, being dynamic, you're able to gauge the patient. A little bit more, a little bit less. So it's a little bit more dynamic than, say, a 5-setting switch where you're 1, 2, 3, 4, or 5 settings. I like the dynamic range because I'm able to tailor it to the patient better. And so nonetheless, I'm going to show you a standard cervical adjustment. We've pre-palpated, we've checked out the vertebrae that we're going to go ahead and adjust, and for demonstration purposes, we're going to adjust C5 today. And so C5 has a direct plane line, so we're going to be going straight ahead as far as C5 is concerned. If you were going to go for something above, say, C4, go 3, 2, or 1, we start raising the instrument stylus to the angle upward. We're going to do the lower cervical spine, we start going past midline, we start going into a downward angulation. That way we go ahead and adjust with the plane line of the discs as well as the vertebrae are concerned, and we're able to get much more of a comfortable and effective adjustment. So as far as I've already preset this, we're about 15% or a little bit past the beginning of the screw down here. And then what we're going to go ahead and do is give her a nice mild adjustment. Now I like putting my finger on the stylus so I can actually feel the adjustment and I can feel the amount of pressure on the neck. I always give a couple of pre-clicks before I apply it to the patient. And when we go ahead and adjust the patient, I stabilize the head. It's important to stabilize the head because what will end up happening is as you push forward to the patient will lean away from you. You can go ahead and just give a light stabilization. You're not cranking down on the head. You're not pushing the device into the back of the neck. You're just giving a little bit of stabilization on the top of the head and a couple of clicks. Usually 2 to 3 will do in one level. If you're going to use this in more of a global region, you want to get multiple level mobilization to occur. Say the patient's got some fusion, you want to get some light motion going throughout the area. They have diffuse osteoarthritis, things of that sort. This is a nice, easy way to get some very, very minor and easy motion in the vertebrae themselves. And we can start working our way up the spine and notice the angle of the device that we're using. Okay? Very important with the angulation, I find, as far as making it comfortable for the patient and also to get the effective adjustment. So once we've adjusted the approximately C2 to C7 in the cervical spine, you could also use this to work the trapezius muscles. Now you can work supraspinatus of the scapula, where you can come right into the muscle belly. And what I like to do is I like to go ahead and actually give a small little gathering of the muscle here, and through the plane of the muscle, not downward to the bone, but through the plane of the muscle, giving it some light taps makes it very easy on the patient and loosens up those knots and the tight musculature that we find so common. This is fantastic for patients that have fibrotic conditions. If you start noticing patients in the 45 and above range, you'll start noticing that the shoulders become fibrotic. You might get some adhesive capsulitis as far as the shoulders are concerned. And this is a wonderful device, very easygoing on the patient. You can start breaking that up and start causing greater motion and suppleness to the muscle tissue. So we're going to go ahead and move on.